My name is Paul Monaro and I'm going to give you an overview of the work I've been doing on low back pain prevention in low back pain and construction workers. I've been a physiotherapist for 30 years and I have extra qualifications in spinal and sports physiotherapy. I've been treating low back pain for 28 years, running my own practice for 25, and these days 50% of my caseload is low back pain. The past 5 years I've been doing extensive research into low back pain in industry. My contribution to bootcamp so far: I've designed the morning warm-up, and this is based on my experience and most up-to-date research from sports medicine. I provide lectures to the trainees on back care principles, lifting techniques, and what to do if they do injure their backs. I provide manager training on similar principles. We've also been doing some musculoskeletal screening on the trainees, and to my knowledge this has not previously been performed in industry. We've screened 43 workers so far, and we're finding that approximately 50% of them are showing signs of moderate to high risk of injury. These are some of the screening tools that we use: endurance tests for back, the abdominal and side muscles. These are some more functional coordination and stability tests, whole body tests that we do. This is a test called the squat endurance test, and while it's designed to test the stamina of the leg and trunk muscles, I'm actually getting a lot of valuable information looking at how people move, and I'm seeing a significantly increased risk on this person on the left by the way they hold themselves when they're doing this task. The big picture, well, the overall problem is that the workers' compensation bill in Australia is close to $8 billion, and the back is the most frequently part of the body injured at work. The construction sector has by far the highest incidence of back injuries across all industries. The reality is that around 90% of construction workers will develop low back pain through their working life. At any one time, you could ask 2/3 of construction workers and they'll tell you they've had a back injury within the previous 12 months, and up to 1/3 will have had a back injury within the previous week. Over 50% of apprentice construction workers over a 1 to 3 year period will develop low back pain. And while I can't give you the statistics, I can tell you that over the last 25 years, the patients I'm seeing coming into my practice with significant back pain is getting considerably younger. I'm now seeing young teenagers with persistent back pain. And here's one of the reasons why. I'll come back to this slide a little bit later and talk about the significance of it. So what's out there to help to prevent back injuries? Over 90% of workers who are surveyed have indicated that they want more information on health and safety, nature of injury, lifting methods, exercise programs, and they also want better access to healthcare within the workplace. What is sadly lacking is that training is really only conducted in around 11% of surveyed workers, and most of them indicated that the training they received wasn't adequate for the job they did. A common component of training is a lifting education program. However, many good studies have found that these techniques are often impractical, rarely useful in the workplace, and don't achieve the goals that they're aiming to. And here's one of the reasons why. We see your typical recommendation of bending from the knees, but I would argue that this subject has his back at risk of injury. Here's a typical sign you'll see in the workplace, and again, I would argue that the subject on the left has a significantly bent back, a weight that's well in front of the body, and a lift that's going to be quite off balance. And I would say that the incorrect lift subject is actually at less risk than the so-called correct one. This is your typical scenario of bending in the workplace, and obviously we can't prevent bending altogether. We can't prevent all strain on the back. But what we can do is educate workers to lift and bend in the most efficient manner and how to compensate for the stresses that their workday places on their spines. I introduce the workers to a concept, one that they haven't heard before. Rather than bending from the back or bending from the knees, we talk about bending from the hips. Here's your subject doing the recommended squat lift, and you can see from the markers on the back how much the back is actually bending compared to when he performs the same lift, but keeping the knees straighter and bending from the hips, the back is considerably less bent. And the biomechanical advantages of this type of lifting is that it uses the large hip and leg muscles. The weight is much more under our centre of gravity, making the lift more balanced. The knees are under less strain, and the back is actually less likely to bend. Is this the way we should bend and lift? Well, not necessarily. There is actually no one correct way. It will vary for each situation and will vary for each person. What we want is for trainees and workers to become experts, to constantly adapt to each different situation so that they can provide the most efficient lifting technique possible. But I firmly believe they need to master bending from the hips and keeping the back straight, and this will form the basis for many of the manual handling tasks they will then perform on the job. What are the dangers to our backs? Repetitive bending, lifting and twisting will often injure these structures in our back called the discs, which are the shock absorbers between the bones. The discs have a central fluid section called the nucleus. Sustained or repetitive bending places pressure that pushes this fluid in one direction and can cause a bulge. And this is what we call pushing the bubble in the wrong direction. What are the dangers to our backs? Well, I believe a lot of them don't actually come from the job. They're set up from what we do outside of the job. Prolonged sitting is a known risk factor, and how we sit actually determines how we move. This is a very telling statistic. A study of apprentice construction workers showed that those who adopted sedentary postures, who did prolonged sitting outside of work, had a 3 times greater risk of developing work-related low back pain. Coming back to this slide, it begs the question, is construction work the cause of back injury in these people? What we're seeing is young people these days regularly bending over tablets and computers, stooping, slumping their spines. What they're doing is deconditioning themselves and setting themselves up to have the type of spines that I'm seeing in older patients of mine and in workers. And the reality is that this will lead to the overall workers' compensation bill of $8 billion blowing out even further. So these are some of the dangers in industry: loading in off-centre positions, bending with a bit of a twist, bending and overreaching, the shoulders offset compared to the hips, extreme bending under load, a side bent position with an awkward load that's creating a lot of torsion on the spine, a 2-person lift but not done correctly with a back that's very bent, a group lift, a back that's in a reasonably good position but the person next to him not so. So what are the solutions? The morning warm-up is one of them, being work ready, preparing the brain, preparing the body for the work activities to follow, being trained not only in the correct lifting principles but training the body in how to move efficiently in a less harmful manner. We train the workers to remember the bubble concept, and this has been adopted now as a philosophy at Productivity Bootcamp. The value of regular straightening and arching the back to undo the stresses and the pressures that build up from the bending that occurs during the day. And performing some screening to hopefully identify those at risk, and then ideally institute movement training to reduce those risks. Coming back to our trainees, this is the sort of work I'd like to spend some time correcting their technique to lower their risk of injury. Working on concepts like neutral spine, concepts like more complex movements that involve bending and twisting, taking this bend out of the back, getting the hips doing more of the work. Sustained bending, getting more efficient back position that doesn't place the joints at extreme loading. And the future, well, what I'm hoping for is that we can extend the work I've been doing with Productivity Bootcamp, educate our future workforce, increasing awareness on how we can reduce the risk of injury both from work but significantly from factors outside of work as well. I believe movement training is key to this, because movement training will help to improve their efficiency, the way that they move, and reduce the risks on their back. And in the long term, ideally we could follow these workers up, particularly the ones at risk, possibly rescreen them, monitor them, create some data on what's happening over the long term with injuries, and ultimately add to the overall research on back pain prevention for the future. Thank you very much.